Is it safe to international travel during this period keeping COVID in mind? We have recovered from COVID a week ago and plan to travel during March. What are the precautions we should take while traveling and after we reach our destination?
Hi, thanks for the question, and I am very glad to help you again with your health concerns. I am now preparing and typing my answer, and I will post my answer here as soon as it is ready. The typing may take few to several minutes depending upon the amount of information that need to be conveyed, and I will follow up with you and post my answer here, the moment I finish with my typing. Best regards, Dr. Subbanna MD. If you receive any phone service offer, please see it is not sent by me, it is just an automated site response, and I am now available for answering your health questions, through this typing/texting format only. I am almost done with preparing and typing my answer. I will follow up with you at the earliest. Please see, in the case of you guys, since you guys already have had COVID infection, so the immunity produced by it should give protection against reinfection, although reinfection with COVID-19 may occur, but the risk is extremely low, and also the immunity produced by the COVID infection is found to be long-lasting. It may protect at least for 6 months, and possibly even much more than this, but please see, some stray cases have occurred within 6 months of previous infection, even within 3 months from the initial infection too. But overall the risk for reinfection is extremely low. If possible, please also try get the vaccine shots. The vaccine shots can give some additional boosting your already existing immunity, but even if vaccine shots are not available, for any reasons, but still the immunity produced by the previous infection should overall give you guys a sound immunity, although please try to take as many precautions as possible during your travel as well as after reaching the destination. Such as the following ones. In general, the following various measures can help to prevent the spread of respiratory viruses, which include both coronaviruses/COVID-19 and flu viruses, etc., or for that matter so many other spreadable microbial organisms too, can be prevented with the below mentioned precautions. 1. Wearing a mask as much as possible, preferably a N95 mask. If N95 is not available, then any available good quality mask is fine too, or even using a clean handkerchief as a mask too can help too. Washing hands frequently, for at least 20 seconds, with soap and water, or using a good quality hand sanitizer that contains at least 60% alcohol, preferably 70%, the sanitizer amount used should be sufficient, and also the sanitizer should wet the hands for at least about a minute or so. 3. Avoiding touching the face, eyes, nose and mouth, etc., risky regions of other people. 4. Avoiding any kind of close contact with people who are sick. 5. Avoiding all non-essential shopping and travels, other than your basic international travels and shoppings. Please try to avoid any redundant travels or shopping, etc. 6. Avoiding crowds and gatherings of 10 or more people. These numbers are relative. It is better to avoid contacts with even a single individual, when such contacts are not absolutely necessary. 7. Keeping at least about 2 meters, which is equal to about 6.5 feet, of distance between yourself and others. The more distance one can maintain, the better. Of course, this is not always possible, especially during flight travel, etc. Such minimum distance maintaining is not possible, but whenever possible, such social or physical distancing should be maintained. 8. Cleaning and disinfecting the frequently touched objects and surfaces, especially items that may be used by other people, such as computers, computer mouse, keyboard, certain garments/clothings, tables, chairs, door handles, shared utensils, etc. 9. Also asking and insisting others to wear masks, if such option exists. 10. Also trying getting plenty of sleep, consuming healthy and balanced diet, adequate exercises, and considering intake of nutritional supplements such as vitamin D, vitamin C, and zinc, etc. These may help in supporting the immune system towards fighting contracting respiratory tract infections, including COVID-19, flu, etc. 11. And, if you guys are suffering from any chronic illnesses such as diabetes, high blood pressure, etc., then these medical conditions need to be aggressively treated. The more these chronic illnesses are kept under tight control, the more robust immunity we build towards preventing contracting infections including COVID-19, etc. The above various measures can help you guys in preventing contracting respiratory viruses including flu, COVID-19 etc., during your international travel or during any other times too. But again, as mentioned earlier too, the recent COVID-19 infection you guys have had is expected to give you guys a sound immunity against future infections, so overall the risk for you guys, to start with, is extremely low, so you guys please not to be scared, or please not to panic. Wishing you guys a very happy and very safe travel. Wishing you guys the very best of health. All the very best. Please let me know if you have any additional questions or if you want to discuss this further. Rating me now will not close your question, and if you have follow-up or additional questions you can ask them after the rating too. Best regards. Dr. Subbanna MD. For future questions you can follow up either here, or you can reach me directly with a question for Dr. Subbanna MD through my Just Answer direct link mentioned below here, http://www.justanswer.com/medical/expert Subbanna MD.
Okay. Also, can we visit the restroom in the airplane? Is it better to consider traveling in a business class than economy, keeping the crowd in mind?
Please see, since you guys have had COVID recently, you guys must already be having sound immunity and this immunity will last for a long time too, so I am really not seeing the need for any precautions, but due to the occurrence of some very rare cases of reinfection the standard approach is to continue with the same precautions that you would have adhered if you guys were not already infected too. So please try to avoid any potential risks of exposure. For example, if traveling in the business class is affordable with you guys then please opt this option because the business classes are obviously far less crowded than the economy class, and also if visiting restroom is something you guys can avoid for the whole flight journey then please do so too, because all these kinds of precautions can reduce the chances of your exposure and help you guys avoiding the risk of reinfection quite significantly.
If you have a health question and want to chat with a doctor now visit justanswer.com/ythealth.